All right, so it is 2 o'clock, and in the effort of time, we're going to go ahead and get started. I know we'll have a few people joining us along the way, but we want to say welcome to all of you and thank you for joining us for our presentation today on what you can't see can cost you, preserving reimbursement dollars with the Provizio SEM Scanner. I'm Karen Schock, the Key Account Director for Bruin Biometrics, and today I'm joined by Dr. Rhonda Sullivan. She is our Vice President of Implementation and Clinical Outcomes, and Dan Raffensberger, our North American Managing Director of Sales. In this session, we will discuss the true cost of pressure injuries and talk about the objective assessment and why it's essential for early detection, documentation of present on admission, and how the Provizio SEM Scanner can support a more holistic approach to prevention, helping to protect patients from preventable harm while also preserving reimbursement dollars. So thank you again for taking the time to join us today. We're excited to share what we believe is a very important topic and one that can make a real difference in your facility. Our goal is to keep the session very concise and also give you the practical knowledge that you can put into action right away. To get the most from the presentation, we are going to encourage you to use the Q&A feature, and we've got some time built in at the end of the presentation to address all of those questions, and also give you a link to register for our next webinar that will be held next month. With that, Rhonda, let's get started.
Thank you, Karen. First, let's talk about the true cost of pressure injuries. Pressure injuries create challenges across every aspect of the quintuple aim. But the Provizio SEM Scanner offers a solution to every challenge. The human toll of pressure injuries is immense. Patients with pressure injuries face profound physical, psychological, social, and financial burdens. Pressure injuries lead to pain, infection, amputations, and loss of function. Patients with pressure injuries also experience psychological distress through anxiety, depression, and reduced quality of life, as well as social isolation and loss of autonomy. Patients with pressure injuries often experience financial hardship due to the cost of treatment, coverage gaps, and high out-of-pocket costs. By preventing these injuries, the Provizio SEM Scanner preserves the patient's dignity, well-being, and quality of life, enhancing the overall care experience. Pressure injuries affect 2.5 million patients annually and disproportionately affect people with darker skin tones. More than half of all pressure injuries are severe, stage 3, stage 4, unstageable, and these severe injuries are associated with complications and even death. The Provizio SEM Scanner improves population health by reducing preventable harm through its ability to detect tissue damage a median of 5 days earlier, allowing for earlier intervention, which can reverse early tissue damage and prevent pressure injuries. Pressure injuries create a massive financial burden. A single pressure injury costs on average $21,767. This cost increases to more than $32,000 in the ICU and can exceed $175,000 if the pressure injury progresses to stage 4. We also know that severe pressure injuries add 13 to 22 unnecessary length of stay days and doubles the risk of readmission within 30 days. Pressure injuries are also the second most common cause of litigation, following only wrongful death. Take that in. Allowing a patient to develop a pressure injury falls just behind death of a person due to negligent, reckless, or intentional actions. Settlements in these cases average $250,000, but judgments have reached as much as $312 million. The Provizio SEM Scanner decreases these unnecessary costs by reducing hospital-acquired pressure injury rates by up to 100%, even in high-risk critical care units, thereby lowering treatment costs, readmissions, length of stay, and litigation expenses. Clinicians spend a significant amount of time using tools like risk assessment and visual skin assessment to guide pressure injury prevention, only to be left vulnerable to blame, guilt, stress, legal exposure when the subjectivity of these tools fail to adequately protect patients. The Provizio SEM Scanner provides objective, reliable, defensible data supporting confident decision-making, allowing clinicians to provide focused person-centered care, which reduces stress, saves time, and preserves the well-being of the care team. Traditional skin methods often fail in patients with darker skin tones because the visual cues we've come to rely on during skin assessment are often absent or look different over darker skin tones. Because we often miss these early visual cues, people with dark skin tones face a 60% higher risk of pressure injuries, are more likely to develop multiple or severe stage injuries, and are 4 times more likely to die from pressure injury related causes. However, the Provizio SEM Scanner is an objective tool that is also skin tone agnostic. The SEM scanner will detect variations in subepidermal moisture and alert the clinician to early, often non-visible tissue damage, regardless of skin tone, ensuring equitable detection and intervention across all populations. So as you can see, the Provizio SEM scanner holistically and directly addresses the clinical, human, and financial burden of pressure injuries, driving measurable improvement across all 5 aims. So what is the Provizio SEM Scanner? The Provizio SEM Scanner is the only skin scanning technology with FDA approval for pressure injury management. It provides a validated, objective assessment of the tissue at the sacrum and heels, where 70 to 75% of all pressure injuries occur. Scanning a patient takes 2 to 5 minutes if you incorporate it into care you're already providing, such as a visual skin assessment, or bathing the patient, or repositioning. The SEM scanner detects variations in subepidermal moisture as an indicator of early and deep tissue damage, a median of 5 days earlier, regardless of skin tone, and provides an independent SEM delta for each anatomic location, enabling individualized targeted interventions. The SEM scanner integrates seamlessly with the electronic health record, streamlining pressure injury documentation and clinical workflow. And most importantly, the Provizio SEM scanner is evidence-based, with more than 209 pieces of evidence, 90 plus peer-reviewed journal articles, and 10 best practice and consensus statements recommending its use. What we also know from this body of evidence is that SEM assessment is statistically better than subjective tools like visual skin assessment, risk assessment, and clinical judgment. Next, let's dig into the tissue damage cascade to understand how the Provizio SEM scanner works. All pressure injuries start with a triggering event, whereby skin and underlying tissues are exposed to intense or prolonged pressure or pressure plus shear. It is important to note that while this triggering event can occur during the hospitalization, triggering events can and often do occur prior to admission, such as in a patient who's been immobile at home, or following a fall with prolonged downtime, or even during a long ambulance ride. Once the triggering event happens, the pressure injury forms for 3 to 10 days under the skin before damage is visible on the skin surface. As the skin and underlying tissues progress through the damage cascade, tissues are deformed and cells are damaged. As cells die, the body responds with inflammation, causing fluid to leak into the tissues. This leakage, called subepidermal moisture, or SEM, is an early biomarker of pressure injury. The Provizio SEM scanner detects this leakage, quantifies it, and alerts the clinician to underlying tissue damage, a median of 5 days, but up to 10 days in some cases before it's visible. If clinicians act during this window, treating the area like a stage 1 injury, even though no visible damage is present, they can reverse the damage and prevent the injury. Without the scanner, the affected area develops high interstitial pressure, ischemia, and tissue death, whereby the pressure injury becomes visible. This delay between injury and presentation can make pressure injuries appear hospital-acquired, even if they began prior to admission. So what's in it for you? Why should you incorporate SEM assessment into your pressure injury program? There are 3 primary reasons. First, SEM assessment enables early detection of tissue damage, a median of 5, but up to 10 days before skin damage becomes visible, regardless of skin tone. This allows you to intervene early, reverse the damage, and prevent the pressure injury. Second, SEM assessment can differentiate pressure injuries from non-pressure injuries. Consider the patient with the darkest skin tone who presents with sacral hyperpigmentation. Many times, this hyperpigmentation is misdiagnosed as a deep tissue pressure injury. However, if you scan the sacrum, the scanner can differentiate non-pressure related skin changes or normal hyperpigmentation from pressure injuries. For hyperpigmentation, the SEM delta would be normal or less than 0.6. If the discoloration was related to a pressure injury, the SEM delta would be abnormal or 0.6 or greater. This differentiation of non-pressure related skin changes from pressure injuries reduces reporting errors, overcomes variability in staff knowledge and skill, and prevents non-pressure injuries from being incorrectly documented as hospital-acquired pressure injuries. Finally, the scanner improves documentation and equity in care. It provides an objective, defensible assessment and documentation of tissue health, identifying non-visible stage 1s and deep tissue pressure injuries on admission, regardless of skin tone. In short, the Provizio SEM Scanner empowers clinicians to detect early, differentiate accurately, and document objectively, improving both patient outcomes and reporting accuracy. Next, Dan will take a deeper dive into how you can use the Provizio SEM Scanner to preserve reimbursement revenue through objective documentation of pressure injuries on admission.
Thank you, Rhonda. Rhonda shared earlier the tissue damage cascade process, and she mentioned that the Provizio SEM Scanner is able to measure subepidermal moisture, which is also known as SEM. A reading of 0.6 or higher is considered a high SEM score and can alert the clinician to the earliest sign of tissue damage. In 2023, the FDA acknowledged that subepidermal moisture is synonymous with persistent focal edema, and the latest ICD-10 coding update now recognizes persistent focal edema as a stage 1 pressure injury. That means that SEM findings can be directly mapped to the ICD-10 codes. So when we document an elevated SEM score on admission, we're not just noting a risk, we're documenting a stage 1 pressure injury that supports a present on admission diagnosis. In other words, the SEM scanner gives us objective, defensible proof that protects the hospital from lost reimbursement dollars. Now let's take a step back and talk about why present on admission, or POA, is so critical in the first place. POA is a critical designation because it determines whether CMS will provide reimbursement or not. It has to be documented at the time of the admission order is written. If it's marked yes or even W for clinically undetermined, reimbursement is protected. But if it's marked no or not marked, CMS assumes it's hospital acquired and reimbursement is denied. Conditions identified during outpatient encounters like ED, observation, or outpatient surgery still count as POA if documented before admission. The biggest risk is unclear or missing documentation, which costs hospitals money and creates frustration for providers. This is exactly where the SEM helps. The Provizio SEM Scanner provides objective, defensible evidence at admission, reducing ambiguity and protecting reimbursement as well as outcomes. But it's not just about evidence. It's also about who documents what. So let's break down the rules of providers and non-providers in POA documentation. On the provider side, they're responsible for making the actual diagnosis and clarifying any conflicting information. On the non-provider side, nurses and wound care specialists play a key role by documenting their findings. The one exception is staging. CMS allows non-providers to stage pressure injuries. Nursing documentation can also be used for coding and timely escalation that makes the process even smoother. The key point is this: both providers and non-providers have essential but distinct roles, and the SEM scanner strengthens that collaboration by giving objective data that the nurses can capture and share and escalate to the providers. So how does this look in practice? Let's walk through an example of SEM documentation in action. Clinical documentation is not just a regulatory requirement. It's a cornerstone of quality care. Regardless of the coding path we take, our responsibility is to assess, intervene, and document in a way that reflects both the patient needs as well as the facility protocols. To show how this works in practice, let's walk through an example using the Provizio SEM Scanner, which helps us to identify subepidermal moisture changes that can indicate early stage pressure injuries. The first thing we do is we scan the sacrum and both heels as soon as possible. These are the most vulnerable areas for pressure injuries, and as Rhonda said earlier, they account for somewhere between 70 to 75% of all occurrences for pressure injuries. The second thing we do is we document the SEM values in the electronic medical record. We want to make sure that both the sacrum as well as the heel readings are in the electronic health records. At first, that can be done manually, but the SEM scanner does have the capability of transmitting that information wirelessly into your electronic health system. Third, we want to see if the SEM delta is greater than or equal to 0.6. If it is, we know that it's a biomarker of persistent focal edema, which is also a stage 1 pressure injury. This should be correlated with the clinical narrative or comments. And then finally, we need to document the interventions we provide, whether it's repositioning, offloading, a specialty surface, skin protective measures, whatever we do, the key is for us to make sure that the patient receives the appropriate care for what is classified as a stage 1 pressure injury. By following this process, a facility can strengthen their documentation, support accurate coding, and most importantly, ensure that patients receive timely, evidence-based care to prevent progression of pressure injuries. Now let's look at 2 specific methods for using SEM data to support present on admission documentation consistently. The slide on the screen actually outlines 2 proposed methods for using SEM delta scores to support present on admission or POA documentation. The reason this is important is that SEM delta scores provide an objective, measurable biomarker for early stage pressure injuries that may not yet be visible. By incorporating these scores into the documentation, we create consistency across both clinical practice as well as coding, and we also strengthen the accuracy of our records. If we look at the left-hand side of the screen, we can see where the clinicians would use the SEM score and provide a narrative. The first step is to add a narrative to the flow sheet. For example, if the patient's sacrum SEM delta score is a 1.4, we document that a SEM delta greater than or equal to 0.6 indicates persistent focal edema and early stage pressure injury present on admission. Then this ensures that the clinical picture is clear and objective, even if the injury isn't visible apparently yet. From there, the coders can then assign the appropriate diagnosis. In this case, they would be coding for the sacral pressure injury as a stage 1 using the L89151 pressure ulcer or sacral region stage 1 pressure injury. They would mark it as POA yes for present on admission, and they would add the procedure code for SEM monitoring. This pathway ensures both the narrative as well as the coding align with the patient's actual condition on arrival. If we look at the right-hand side of the screen, it's more about the coding side or a coding perspective. This process begins by identifying an elevated SEM deltas on admission. In the example, the sacrum has still the 1.4 delta reading, which again is a high score. It's greater than the 0.6 and indicates that there's non-visible tissue damage already present. Once identified, the coders can then use that high SEM score to indicate that it's an L89151 stage 1 pressure injury on the sacrum. They can also indicate POA yes as the indicator and the SEM monitoring procedure code. This streamlined process provides consistency, clarity, but more importantly, defensibility and documentation. What's powerful here is that the clinicians and the coders are working from the same objective measurements. Some deltas give us shared language that links early clinical findings with coding requirements. It helps facilities protect coding from coding disputes and supports regulatory compliance but most importantly, it ensures the patients get timely interventions. SEM scanning just doesn't help with stage 1 pressure injuries. It can also support documentation of more complex, deep tissue pressure injuries, or DTPIs. Let's take a look at how we would code those. This slide focuses on how we can use SEM scores to support documentation for deep tissue pressure injury, or DTPI, that is present on admission. The key point here is it's not just one single elevated SEM score, but rather it's monitoring those changes over time that signal that tissue is changing or evolving beneath the skin surface, and that pressure injury damage is occurring before it is actually visible. The process starts with monitoring SEM scores over a 3-day period. On admission, we establish a baseline. In this example, we see a SEM delta score of 0.9. We scan again on day 2, and we see that the SEM score continues to escalate, 1.2 on day 2 and 2.2 on day 3, even though we put interventions in place. This is known as the acceleration effect, and there are studies to indicate that based upon that acceleration effect, that the underlying tissue is leading to a deep tissue pressure injury. This is particularly important because it may not be visible on the surface of the skin yet, but it's present and consistently evolving. When documenting the narrative should capture both the admission value as well as the progression. For instance, the SEM delta score is 0.9 on admission and escalating over the next 2 days, demonstrating an acceleration effect. This is suspicious for a non-visible pressure injury, consistent with DTPI, present on admission, and that the provider has been notified. This language allows us to tie the objective data to the clinical suspicion, making the case clear for coders and defensible in the medical record. From a coding perspective, the documentation allows the coders to apply the correct diagnosis. In this case, it would be an L89.156, indicating a pressure-induced deep tissue damage of the sacrum. The POA is marked as either a Y or a W, depending upon the site as well as the timing. And just like before, the SEM monitoring procedure code is added. Again, this ensures that both the clinical narrative and the coding align with the regulatory expectations and the facility protocols. By linking serial SEM delta scores with clear documentation and coding, we create a powerful process that protects the patients, the providers, and the healthcare facilities. It allows us to realize that recognize DTPIs early, document them accurately as present on admission, and demonstrate that the interventions were initiated. Of course, all of this only works when providers, nurses, and coders are working together. That's why collaboration is absolutely necessary. Providers and coders depend on each other. Providers must give clear documentation, and the coders must then apply the right codes. STEM data strengthens this partnership by giving both groups a shared, objective reference point. To make this work, facilities need to ensure 2 things. One is clear SEM documentation policies, and the second is making sure that everyone is compliant with those policies and applying them consistently. When collaboration is strong, clinical quality improves and financial integrity is protected. And speaking of financial integrity, let's take a look at what POA documentation means in dollars and cents for a hospital. This slide gets to the heart of why POA documentation is so important, not just clinically, but also financially. Pressure injuries are a high-profile quality measure, and the way they are documented at admission has a direct impact on reimbursement. The 2 images on the screen are for a patient who is admitted with congestive heart failure as their primary diagnosis. You'll also see a few secondary diagnoses on the screen as well, with the third being a stage 4 sacral pressure injury. Now, I know that if you had a patient on admission with a stage 4 sacral pressure injury, that you wouldn't need the Provizio SEM scanner. But let's assume that this patient had the triggering event and that tissue damage cascade process was already underway when they arrived at your facility. But when you did the visual skin assessment, you saw no visual skin damage to that individual. And so based upon your assessment, the indication was present on admission, no. A few days later, a visible pressure injury developed, and it quickly progressed into a stage 4 pressure injury on their sacrum. In that scenario, on the left, you would have received just over $29,000 in reimbursement for this patient. If we have that same patient and they're going through that triggering event and that damage cascade process is underway when they come through your doors, but this time you use the Provizio SEM scanner to scan that patient on admission, you would have directly assessed the patient, you would have detected the presence of persistent focal edema on their sacrum through a high SEM score, and you would have intervened, but also based upon that SEM score, you would have indicated a stage 1 sacral pressure injury, that is POA, yes. We would hope that the interventions that you would have put in place would have worked and reversed that tissue damage, but let's say it didn't. Let's say that tissue damage continued to progress and it led to a stage 4 pressure injury. In that second scenario, you would have received just under $42,000 in reimbursement dollars, meaning you would have captured about $12,645 more in reimbursement by using the scanner on admission to detect that non-visible damage and to give yourself that insurance that if it did progress, even despite best care, that your reimbursement dollars wouldn't diminish. This difference underscores the reason why timely and accurate POA documentation matters. If we fail to capture that a pressure injury was present at admission, not only do we risk compliance concerns, but the hospital also absorbs the cost of care. On the other hand, proper documentation protects the facility financially and demonstrates that high-quality care was provided from the start. Our hope is that today's session has made one thing clear. What you can't see on admission can absolutely cost you and the healthcare facility. By using the Provizio SEM scanner on admission, you can detect non-visible tissue damage earlier. This not only supports present on admission documentation and protects your reimbursement dollars, but more importantly, it allows you to intervene sooner and to deliver best-in-class skin health for your patients. Thank you.
So I want to say a big thank you to Dr. Rhonda Sullivan and Dan Raffensberger for walking us through today's content. It was incredibly informative, and I know many of you may have questions. So we want to shift gears and spend some time answering those questions. In addition, you'll also find our contact information on the screen. So now let's move to the question portion.
So Karen, I see one of the questions here from one of the attendees, and maybe I'll read this question and kind of pose this question to Rhonda if I could. Rhonda, the question is, if there's a stage 1 that's present on admission, but then the wound becomes a stage 3, would it not be considered a happy since the wound stage deteriorated? I could see a POA DTPI being defensible, but a stage 1 that becomes a stage 3 seems iffy. Thanks for your clarification.
Yeah, so the sole purpose of present on admission is to acknowledge that something was brewing at the time of admission. And so according to CMS, although there are 2 codes, and that's really for tracking purposes only, the present on admission pressure injury never becomes a hospital acquired because it was present on admission. It can't be both. And so, yes, you would still track that the deterioration more from your quality perspective, but from a reporting perspective and a POA perspective, present on admission cannot be hospital acquired. They're 2 different things.
And Rhonda, I saw that question. I know you had already provided the answer in the chat, but it's also given folks an opportunity to submit additional questions using the Q&A feature. I guess the other question that was there was about, just for clarity reasons, about only using it on the sacrum and the heels. What about the buttocks and the coccyx? Anything you can share there?
So the Provizio SEM scanner is only indicated for the sacrum and heels. And so that accounts for 70 to 75% of all pressure injuries. We do know that pressure injuries occur in other places. The reason why we are approved for the sacrum and heels is because the body of evidence that we have supports both that ability of the scanner to use that delta to identify pressure injuries at the sacrum and the heels. Other places have been studied, other body parts have been studied, but what we don't know is with confidence what that delta cut score is at those other areas. And so we follow the evidence, and so does the FDA. And so that's why we're approved for the sacrum and heels. The other comment that I made is that what we know in practice is sometimes nurses will call the buttock or the sacrum, the buttocks or the coccyx. So making sure that it is in fact a sacral area, then it could be included in your POA documentation. So there was a comment that popped up.
I think Angela was just thanking you for the response, as well as letting you know that the locations are also confirmed by the CWOCN team at her facility.
Yes.
I think for those that are still in the line, I know we're currently over by a minute. I do see another question that came in. The question mentions intact skin. Is there utility to use a SEM measurement adjacent to open skin? Rhonda, do you want to take that one?
So it's only indicated over intact skin. What I will say is that is for two reasons. First of all, infection control, but also because it's a prevention device. And so we're trying to detect what's happening underneath. So I would say the FDA indications are over intact skin for those two reasons.
There was another question here, and the question was about have any locations started using the Provizio SEM Scanner and also the present on admission documentation? I can say that there have been facilities that have been doing this for some time. Have they been finding the coding and the documentation helpful? I would say recently we started sharing this information out as we ourselves have met with health insurance organizations, CMS, FDA, and others to kind of, I guess, get a stronger understanding of what we're able to communicate. So I think where we're at this point is sharing this information with you based upon the conversations we've had. We feel confident in the information that we're sharing with you. We've developed reimbursement manuals that we're happy to share with your teams. In a bit, there will be a slide where it has our contact information. If you'd like to have a more one-on-one conversation, or perhaps dive into this even deeper, where we can maybe meet with your team clinically as well as the coders, we're doing that with a few facilities in order to kind of create that forum or that area where that exchange can occur, and then the teams can talk about how do we do this at our facility. So that would be my response to that one. I think as far as will we be sharing the presentation, I would say reach out to us if you're interested in the presentation or interested in additional information. As I mentioned, we do have manuals. We have other information that we can certainly provide to you, and we're happy to support you in the journey with regard to the SEM scanning and present on admission. I see another question here, Rhonda. It's, what if a pressure injury is identified by SEM but not seen by a WOC or RN or any human eye? Let's say the patient passes away the next day and we never see the PI. Are we potentially liable?
I was typing, so I'll answer it here. It is highly likely that the SEM scanner will detect damage that you cannot see. Remember, if you go back to the damage cascade, it's detecting that tissue damage 5 up to 10 days before you're going to see anything visually. So yes, it's going to detect that pressure injury, but you have to realize that it's detecting it at a stage 1, potentially a deep tissue injury over the course of 3 days. So it's going to be in the record that the person had an elevated SEM delta, but I think if the person passes away the next day, it's likely unavoidable. That would be my go-to for a person who has a pressure injury in close relation to passing away. So I don't know that you would necessarily be liable, but I think what you're detecting is in essence a stage 1, but you won't see it at the time.
Correct. Thank you, Rhonda.
So Dan and Rhonda, I want to say thank you again to you for the wonderful presentation, and thank you to all the attendees. Our next webinar will be held on September 10th at 1 p.m. Eastern Time, and it's going to be connecting the dots on the new ECQM hospital harm pressure injury. This has been a hot topic, and we look forward to providing some additional information to you. You can scan the QR code here if you would like to register, and it's also been put in the chat, and we hope to see you again then. Thank you so much for attending.